Why is healthcare financing so crucial in our modern world? Well, let's dive in and explore. Healthcare financing is the fuel that powers the engine of medical services, ensuring access to quality care for all. It's the vital lifeblood that keeps the heart of healthcare pumping, enabling hospitals to operate, doctors to treat patients, and research to continue advancing. Imagine a world without adequate healthcare financing. Hospitals would struggle to stay open. Doctors and nurses might not get paid, leading to a shortage of medical staff. Patients could be denied the treatment they need due to lack of funds. Research into new treatments and cures would grind to a halt. It's a bleak picture, isn't it? This is where the role of governments and private investors becomes crucial. They hold the purse strings that can make or break a healthcare system. Governments have the responsibility to allocate sufficient funds to healthcare in their budgets, ensuring that public hospitals can provide essential services to the population. Private investors, on the other hand, bring in additional resources. They can fund private hospitals and clinics, contributing to the diversity and reach of healthcare services. Private investment can also spur innovation, leading to the development of new treatments and technologies. But healthcare financing is about more than just providing funds. It's also about efficient and effective use of those funds. It's about ensuring that every penny spent brings the maximum benefit to patients. It's about finding ways to reduce costs without compromising on the quality of care. It's about striking the right balance between cost and benefit. In essence, healthcare financing is a complex and challenging task. It requires careful planning, rigorous assessment, and constant monitoring. It requires a deep understanding of the healthcare landscape, the needs of the population, and the dynamics of the healthcare market. So you see, healthcare financing is not just about money. It's about ensuring everyone has access to the care they need. It's about building a healthcare system that is sustainable, equitable, and responsive to the needs of all. It's about creating a healthier and happier society for us all. And that is why healthcare financing is so crucial in our modern world. What does it take to create a sustainable healthcare facility? A detailed project report. A detailed project report, or DPR, is more than just a document. It's a roadmap, a guide, a blueprint to success. It's a comprehensive analysis of every aspect of a project, from inception to completion and beyond. In the realm of healthcare financing, a DPR is an indispensable tool that aids in decision-making, resource allocation, and strategic planning. Consider a new hospital project. The DPR would not only gauge the financial feasibility of the project, but also delve into the technical aspects. It would examine the facility's potential services, staffing requirements, patient flow predictions, supply needs, and estimated costs. It would assess the hospital's potential impact on the community and its sustainability. This meticulous preparation and planning is not just for the benefit of the project's initiators. It's for the stakeholders, the investors, the community, and most importantly, the patients who will ultimately be the beneficiaries of the facility. In the process of crafting a DPR, the project team utilizes structured instruments to gather data. This data not only informs the current project, but also contributes to a larger body of knowledge that can be tapped into for future projects. This is how we learn, grow, and improve. But the value of a DPR does not end with the completion of the project. It continues to serve as a reference point, a measure of success or failure, a tool for evaluation and improvement. It helps in identifying the gaps, the areas of improvement, and the steps to be taken to bridge these gaps. In healthcare financing, a DPR is not just about numbers, it's about people's lives. It's about creating a healthcare facility that meets the needs of the community, that is accessible, affordable, and high quality. It's about ensuring that every dollar spent is a dollar well spent, that every decision made is a decision that serves the best interests of the patients. So what does it take to create a sustainable healthcare facility? A detailed project report. Because in healthcare, as in any other field, knowledge is power, and a well-informed decision is always a better decision. A detailed project report is a blueprint for success in healthcare financing. Let's dive into a real-world example to illustrate these points. Imagine a new health facility in the heart of Kenya. The first step in creating a detailed project report is to conduct a thorough study of the demand and supply dynamics of health facilities in the region. This includes using structured instruments to gather data on existing clinics, facilities, services, staffing, patient flow, supplies, and costs. From this data, we can estimate the capital and operating costs of the new health facility, considering both rural and urban factors. We can also evaluate the operations and management of the current health service providers to determine the best structure for an expanded healthcare system. Next, a cost-benefit analysis, or CBA, is conducted. This involves comparing the cost of establishing and operating the facility to the benefits it will bring to the community. This can include a range of factors, from improved health outcomes to job creation. An integral part of this process is conducting a social return on investment analysis, or SROI. This involves calculating the social impact of the investment, translated into monetary terms. The forecasted SROI provides a clear picture of the potential social benefits of the new health facility. Market sizing is another crucial step. This involves a top-down and bottom-up analysis to determine the total available market, or TAM, the served available market, or SAM, and the share of the market, or SOM. This gives us a clear picture of the potential customer base and the potential market share of the new health facility. The detailed project report also includes a SWOT and PESTLE analysis of the health sector to identify strengths, weaknesses, opportunities, and threats, as well as political, economic, social, technological, environmental, and legal factors that could impact the project. In the end, the detailed project report provides a comprehensive overview of the feasibility of the new health facility, considering a range of factors including demand and supply dynamics, cost-benefit analysis, market sizing, and strategic analysis. This case study illustrates the complex considerations involved in healthcare financing. The Health Financing Progress Matrix, a tool by WHO, gives us a comprehensive overview of a country's health financing system. This matrix is a qualitative assessment method that provides us with a bird's-eye view of how a healthcare system is financed. It is an invaluable resource for both government bodies and private investors, aiding in the identification of areas that need improvement and the development of strategies for efficient healthcare financing. One key aspect that the Health Financing Progress Matrix evaluates is revenue raising. This involves assessing the methods and efficiency with which funds are generated for healthcare services. It scrutinizes the allocation of health budgets, the role of out-of-pocket payments, and the overall governance of the healthcare facility. By reviewing these factors, we can gain insights into how to optimize revenue generation while ensuring that healthcare services remain accessible and affordable for all. The matrix also focuses on the pooling of revenues. It examines how funds are collected and combined to finance healthcare services. This is a crucial aspect as it determines how risks and costs are shared across the population. It helps us understand if the current system is equitable, and if not, how it can be restructured to ensure that every individual, regardless of their economic status, has access to necessary healthcare services. Another important aspect that the matrix investigates is the purchasing of health services. It assesses how effectively the pooled funds are used to buy or provide health services. This involves looking at procurement methods, facility utilization ratios, and the efficiency of service delivery. By evaluating these factors, we can identify areas of wastage and develop strategies to ensure that every penny spent translates into quality healthcare. In essence, the Health Financing Progress Matrix is a comprehensive tool that allows us to understand the strengths and weaknesses of a health financing system. It pushes us to ask the right questions, encourages transparency, and promotes accountability. With tools like the Health Financing Progress Matrix, we can ensure that our healthcare financing systems are robust and effective. Healthcare financing is a balancing act between financial returns and social returns. As we've seen throughout this exploration, financing healthcare is a complex, multifaceted endeavor. It's not just about the numbers, it's about the people and the impact on their lives. It's about balancing the need for financial sustainability with the essential goal of providing effective, accessible healthcare for all. The importance of healthcare financing cannot be overstated. It's the backbone that supports a robust and resilient healthcare system, enabling it to weather challenges and adapt to changing needs. It fuels everything from the day-to-day operations of clinics and hospitals to the development of new facilities and the implementation of innovative health programs. Equally vital is the need for a detailed project report. This comprehensive document lays out the technical and financial feasibility of a healthcare project, providing a roadmap for its execution. It covers everything from supply and demand dynamics to cost-benefit analysis and market sizing. It's the tool that allows us to identify potential pitfalls and opportunities, helping us to make informed, strategic decisions. The Health Financing Progress Matrix, developed by the World Health Organization, serves as a standardized qualitative assessment of a country's health financing system. It gives us insights into the policy process and governance, revenue raising and pooling, and the purchasing of health services. It's a key instrument in understanding the strengths and weaknesses of a system and charting a path towards improvement. But at the end of the day, it all comes down to balance. It's about finding the sweet spot between financial returns and social returns. It's about ensuring that the system is financially sustainable while delivering on its primary mission, to provide quality, accessible healthcare for all. As we navigate this intricate landscape, we must remember that healthcare is not just a business. It's a service, a commitment, a vital part of our social fabric. It's about people's lives and well-being. It's about building healthier, more resilient communities. With careful planning and strategic financing, we can build healthcare systems that serve everyone effectively and sustainably.
The mission of Velocity Project Management Limited is to be knowledge partners by providing project management consulting services along with training services. Our vision is to be the leading institution for project management and management consulting services in East and Central Africa within healthcare. 1. Business planning. In planning, we start from the conception/idea of opening a health facility for our client by advising to do the right sizing of the facility, placement of the facility, and business guidance is provided too. 2. Infrastructure development involves engineering services, procurement management, tender management, project management, guidance on negotiation. 3. Equipment design and supply. Medical and non-medical equipment and maintenance are equally important to run a hospital, which needs planning from the beginning of conception. Proper contract management with all suppliers for spares and training of all HR involved. 4. Operations, management, training. Running of the hospital and handholding is taken care of by providing the right HR, business process mapping, HIMS, standard operating procedures, and defining various policies.